I would like to review our patient handbook with you. We use the handbook as a communication tool, and there is even a section for you to take notes or write questions. There are a few things I need to go over today. As our patient, you have rights, including a right to dignity, respect, and confidentiality. To be provided payment information, to receive quality care and be a key decision maker in your care, the right to voice your grievances, but we ask that you first bring concern to us so that we have an opportunity to immediately try to remedy them. You can reach my manager at this number. On the other side of the coin, you have the following responsibilities: to provide us with accurate health information, participate in the plan of care and follow directions, show respect and consideration to our staff, and notify us if there are any changes to your insurance coverage. These sections outline our transfers and discharge policies. Next is advanced directives. I see in the computer that you have completed an advanced directives in 2001, and your husband is your representative. Is this copy the most current? And are there any changes that need to be made?
Oh, no changes.
Also, on this page is important safety information. We will review some of this after my assessment, but we'll be referring back to this often while you are receiving home health. There is COVID information on this sheet, important phone numbers and websites here. I am writing our office number here on the folder. You can call this number 24 hours a day, 7 days a week for any needs. The medication list, side effects, information sheets, your action plan, and calendar we will review at the end of the visit. We offer a variety of methods to support you in addition to in-home visit. You may occasionally receive e-visits, which are assessments conducted by our nurses over the phone. Additionally, we use automated follow-up phone calls periodically to check on you. You will be asked a few questions about your health and progress. Please answer the questions using the phone keypad, and then, based on your answers, a registered nurse may call you back to offer help and instructions. We will make every attempt to assure you understand the important information we have for you. So please stop me and ask questions if I use a word or an explanation you do not understand. You have a really excellent team. We treat a lot of patients with your diagnosis. If you are agreeable to home care, we can review and sign the service agreement. This is a paper copy explaining that you are consenting to let us treat you and allowing us to bill your insurance. This agreement covers all disciplines that will be coming in the home. However, we will be signing the service agreement electronically, so I need to ask you to wash your hands. Now that we have completed your assessment, I have the following safety recommendation to set your home up to prevent falls. Keep pathways clear, remove the throw rocks, and be careful with your oxygen tubing so you don't trip on it. Speaking of your oxygen and fire prevention, does anyone smokes in the home?
No, no one smokes.
Well, if anyone does, the oxygen concentrator must be turned off and they should smoke outside. I was happy to see that you have the oxygen in use sign on your door. Next, let us discuss your action plan, which tell you when to contact us and when to call 911. It is set up like a stoplight. I want you to call 911 for any of the red zones, such as a very fast heartbeat or severe chest pain, very fast or difficulty breathing, or sign of a stroke such as a hard time talking, moving an arm, leg, or head, neck, blurred vision, or facial droop. The yellow zone requires you to notify us same day so we can figure out what's going on and work with your doctor to keep you out of the hospital. For you, the things that I want to pay particular attention to are any falls or near falls, more shortness of breath or coughing up more phlegm, more pain, or problems with your drain. Everything in the green column means all is well. Because you have a surgical drain, another important safety concern is infection. An infection can turn into a life-threatening condition called sepsis. This sheet here lists common signs of an infection in a yellow zone, such as having a fever or the chills, feeling more tired than usual, changes in your heart rate or breathing, increased pain, redness, or drainage around your drain. Please take a look at both the yellow and red zones on this sheet, and we will talk about it at my next visit. Finally, another important safety measure is creating an emergency disaster plan. Here is some helpful information on what to do in an emergency such as flood, and you can start to fill out your emergency contact information here.
I need to talk to my daughter about this.
Sounds good. I'm going to assign reviewing this with your daughter as your homework, and we can discuss at my next visit. Taking your medications correctly is important to keep you safe at home. Here is your written medication list. Remember, one side effect of your pain pill is drowsiness. Before I go, I want you to know when I'll be back out. I'm planning to see you 2 times a week for 3 weeks for drain care and medication instruction. All of the discipline will be used in this calendar to document what services you will receive and how often. And can you tell me what number to call if you need something? Great. Thank you so much for letting me come work with you today.